Of course I'm excited. I'm always excited. I mean, like most of the time. Don't hit that.
I know, I'm sorry.
Hey everybody, welcome back to the podcast. My name is Danny Phillips, if you don't know me, and I've got one of my business partners, Scott LeBlanc here. Say hey.
Hello.
You guys might know him if you train here at the training ground, or if you listened or watched our podcast episode last week. We wanted to go a little bit more in depth, kind of talk about Scott's physical therapy background, how that is integrating with personal training here and with nutrition, I guess.
Yeah.
And just give him the chance to have the floor and kind of just give a little more understanding of who he is, how he came to be here, and what he's about. So take it away.
Take it away. Where do we begin? I guess my introduction to physical therapy was at the age of 10 years old.
That's young.
Yeah. So I tore my ACL playing baseball at 10 years old, which is kind of unheard of. Usually ligaments stretch a little bit more, and mine.
So you were not stretchy.
Mine stretched all the way. It just blew up. So yeah, the surgeon said he didn't know if I tore it or not, but it wasn't there anymore. So
it's gone.
It was gone. It just blew up.
Oh man.
Yeah. So 10 years old. So did some therapy down in Baton Rouge. Couple of months there, and I was able to go back and play baseball. In the same season. So
wow,
yeah,
that's impressive.
So it was good. So that started at 10. I wore a custom brace from 10 to 16. Started going to the gym with my brother. So got introduced into exercise. Shout out to my big bro for helping me with that.
Aww.
And so that's when I kind of realized that I was going to have to stay on top of things in order to continue playing sports. So I played football, basketball, baseball with a custom brace on throughout middle school. And then once I got to high school, played my freshman, sophomore year, and then had surgery my sophomore summer.
So you went from age 10 until the summer of your sophomore year of high school
years old,
before you had to. Okay,
correct.
So 6 years of playing without having surgery.
Yeah.
Why? Why such a long wait?
So at the time, they didn't have a surgery, a technique to not drill through your growth plates. And so they didn't want to stunt growth of one leg by doing so. So now there's a technique where they can bypass the growth plates to do an ACL repair or reconstruction. So yeah.
That's wild.
Yeah, it's pretty wild.
Was it painful for 6 years, or did you like?
No, I mean, I definitely. It's funny, older people say they can feel their joints hurting when weather's changing.
Yeah,
like that's a real thing. Like I experienced.
Could you tell
that.
at age 10?
Yeah, age 10, I knew when like a storm was coming through. So that's a real deal. Outside of basketball, I didn't have an issue with my knee. So basketball was the only sport where, I might make it through a whole game, or I might have, an instance where my knee would kind of sublux, which means that it just kind of barely comes out of place and then would go right back in. And at that point, then I was done for the rest of the game. So,
oh, wow.
But other than that, I mean, that wasn't like a normal occurrence. So I was pretty lucky to be able to be, well enough and strong enough to continue playing. So,
no kidding.
Yeah.
Did you have to do physical therapy at age 10?
Yeah. So I spent probably, I don't know, a month and a half maybe in PT doing just various things, balance training, strengthening, just to be comfortable with going back out and playing sports.
And was there something about that PT that had you like, oh man, this is really cool. I can see how it's helping me. I want to be a physical therapist.
Yeah.
Or did that come later on?
Yeah, no, I mean, unfortunately, I don't remember her name, but she was super fun.
Okay.
Like we were in.
That's what made you super fun.
Yeah, absolutely. Okay. Yeah. So, I mean, we were in like this great setting. Like I would literally do single leg squats on a trampoline and like shoot a basketball while I was doing it. Like it was all like it was all a game.
Yeah. She
was definitely very good at what she was doing. And I thought it was a lot of fun, and obviously it helped me out. So yeah, that's how I became interested in it. So I guess we go forward.
16, right?
So
you had your surgery.
When I had my surgery.
So what was the recovery like
the
from
recovery,
that?
So this is very interesting. My surgeon down in Baton Rouge did not want me to rely on physical therapy. And so
Why?
He wanted me to do all of my therapy essentially on my own.
Why?
So his reason was
that... What 16-year-old knows how to do that?
Right. Well, he knew I was motivated to get back to baseball.
Okay.
I had surgery in like probably June, July, end of June, beginning of July. So that gave me 6 to 7 months to get back before the high school baseball season started. Um, and his reasoning was he didn't want me not to do something on one day knowing I'm going to therapy the next day. Like say, oh, well, I won't do my exercises today because I'll just do them tomorrow at therapy. Like he wanted me, he had everything printed out. It was laid out for me, the
Okay.
regimen of exercise, what I needed to do on a daily basis. And so that
Essentially,
was,
he knew you didn't need the accountability of having to show up somewhere to
I
do them
guess
with
so.
somebody
I mean,
else.
I really guess so, but
Which
after
a lot of people
being,
need.
yeah, after being a therapist for like, for 8, almost 9 years, it's kind of like, man, I wish I would have just have somebody to
Even touch
walk you
base with.
through it. Yeah, because
Yeah.
it's such a, you don't understand what should I expect at this point, or what is this feeling, or why does my knee feel like I can bend it perfectly fine, and then when I go to like kneel down and bend it, it just
Yeah.
hits a block, So there's a lot of questions, I guess, a 16-year-old doesn't realize he has
Well,
at the
shoot,
time.
I'm 33, and I feel like every week I ask you dumb, quote unquote, dumb
Right,
questions, but like
right.
I just want this peace of mind. Like, hey, it hurts, but like I'm okay with it as long as it's supposed to hurt.
Yeah,
Like,
I
just give
mean,
me that peace of
you just
mind that
want
this is what it's
somebody,
supposed to be doing.
yeah, you want somebody to tell you like this is normal or this is what we expect, but I guess I had a pretty easy recovery process. I mean, I was, right when we got back from Christmas break was really the first time I really started running, and that's right when we started baseball preparation.
Okay.
So I literally ran a mile every day for like 3 weeks.
Sounds awful.
Yeah, it was horrible. I hate running, but I mean, it got me back into that condition and endurance and stuff like that. Did my knee feel normal that year during baseball?
No.
Not at all. I mean, it fatigued pretty easily. Do I feel like I could have been a little further ahead with some more professional guidance therapy wise? Absolutely. But
you live and you learn.
Yeah, you live and learn, and then that was another factor that I
wanted
to become a physical therapist. Yeah, so it kind of all played its role into getting me where I'm at right now. So
okay,
yeah.
All right. So we've gotten through high school, we've graduated. What did college look like in terms of deciding on a degree and that kind of program?
Right. So I knew I was interested in human movement and exercise, stuff like that. So I went the kinesiology route. Actually started off at the University of New Orleans. I went there for 1 week. And then Hurricane Katrina hit. And so then I tried to go enroll at LSU. The line was from here to, Dallas. It was huge. And so I went to a small community college for the first 2 semesters and then transferred to LSU, majoring in kinesiology, graduating in kinesiology. And my junior year of college, I got a job at Traction. I met Mac.
Traction Sports Performance, which is down in Baton Rouge.
Yes. So Mac Chiwilli.
Is that how you say his last name?
That's how you say his last name.
Chiwilli. Okay.
Yes. He got me started in the strength and conditioning sports performance world. So, and loved it. That was fantastic. So worked for him almost 4 years full time. But kind of towards the end there, felt like I needed more knowledge, more credibility. And, I had all these prerequisites that were required for physical therapy. So
it seemed like a logical
path. It's the next logical path, right? So,
and at this point, you'd already met Ian, right?
No,
not yet.
No,
okay.
I was still in Baton Rouge. So,
okay.
So then I started PT school in 2012. So that brought me to Shreveport. Started school here 2012. Graduated 2015. Started dating Emily at the time, and so that kept me here. And
you always got to wonder what keeps someone in Shreveport.
My lovely wife, which has
been
great.
You, Emily.
It has been absolutely wonderful. Family's great, kids are great, jobs have been great, and opportunities are great. So,
but this one's your favorite.
This is my favorite so far. Yeah. So 2015, took a job in Minden, working at an outpatient clinic.
That's a hike.
Yeah, it was a hike, but it was a really good opportunity. They needed some young therapists. They had a new orthopedic doctor there. We were going to be working pretty closely together. So it was a good opportunity to learn and really have somebody support you and get things that you need as far as orthopedics go. So that was really good. During that time, that's when the Shreveport Raptors were kind of born, the soccer team. So, and that's when I got hooked up with this guy
Do
back
they
here.
still exist?
They do not exist. No.
Okay.
So we had a really good time. That's where I met Ian.
We're going to give a whole nother podcast episode dedicated to like the background of the training ground and like everybody's meeting points and stuff like that.
So met Ian there.
So subscribe if you haven't already, so you don't miss
right,
it.
That's right. More to come.
Mm-hmm.
So met Ian there and kind of started forming that relationship. We knew that we kind of fed off of each other, thought about things a little bit differently from different point of view, but kind of on the same page, so to speak. And so we did a few things together. We had a small business at one point, Catalyst Sports Performance. Yeah, Ian. Yeah.
If y'all are not watching the video, Ian is sitting behind us working at his desk, and so he just keeps lifting up a hand to say hey now and then.
So we had the opportunity to work with Centenary Gymnastics, Centenary Basketball, a local youth baseball program, and then life just kind of got busy, and so we did some stuff with the Mudbugs too, actually. So so several different entities that we were able to work with, and then, like I said, life got busy. So
seems to do that.
Yeah,
at least for entrepreneurs.
Right. So I was back here, trying to start a family, wife's pregnant, stuff like that. So starting a new job. So all these things kind of came together, and just didn't have time for all that stuff. So, yeah.
So when you were at that clinic, you called it a clinic in Minden?
In Minden, yeah.
I guess I'm trying to figure out what brings a physical therapist maybe into a specialty. Like if you don't really know what you're getting into with a specific clinic, like can you specialize at a clinic, or clinics particularly specialized like in their own right?
Right.
Like what were you interested in specifically, and how does that look?
Yeah. So prior to school, you're required to do several observation hours, volunteer hours in PT settings. And so the only one that I was familiar with was the outpatient setting. So I knew that's what I liked. I knew it was kind of more able-bodied individuals that were there to get better, a little more motivation, a little bit more to work with, so to speak. And so that was what I was familiar with. Going to school brought me to be familiar with the rehab setting, the acute setting, skilled nursing setting, all these different, even wound care, all these different avenues that I didn't even know really were part of physical therapy. So
wound care seems like a whole another field.
Right. But I mean, you think about it, like in a hospital, somebody has surgery, nursing sees them, physical therapy sees them to get them up and moving. And so you had that need there.
So it's like you kind of have to do a little bit of wound care just in case you need to.
Right. But then, I mean, at LSU, there's several professors that specialize in wound care. They've written books on wound care. And so they have a residency on wound care.
Oh, wow.
So it's like it's a big deal. And then even with the diabetic population, that's physical therapy wound care is a huge need.
That's interesting.
Yeah, it's very interesting. But I knew I wasn't interested that much in the wound care.
Wound care.
So, yeah. And I felt like the orthopedic setting was the most relatable to sports and return to sport and things like that. And that was my interest. So.
Well, and that's what you went through.
Right.
So
right.
That makes sense.
Mm-hmm.
I love it. I love it. So do you feel like that is where your specialty is now, in that return to sport aspect?
I think so. I think that my experience has allowed me to relate to athletes a little bit more. Like, what they're going through, how bad they want to be out on the field, but at the same time, you want to make sure that it's the appropriate time to be doing the things that they need to do. So, I feel like you see it from a little different view, rather than somebody that's never played sports before trying to tell an athlete, this is what you need to do.
The athlete's going to be like, you don't know.
Like, what do you know, right? So it's all about the credibility for me. So that's kind of a big deal.
Do you have a favorite type of return to sport injury you like to work with?
I mean, special place in my heart for some ACLs.
Sure.
That's kind of I don't know. It's a fun one. It's especially when you have somebody that is motivated and kind of higher level, just trying to figure out different ways to to push them and to get what you can out of them in preparation. So,
Yeah.
yeah.
I'm kind of curious just to give our listeners maybe let's pick 2 or 3 like injuries that you see frequently. What does that typical timeline of return to sport look like?
Yeah.
Because I know, again, I'm asking kind of curiosity wise for myself. People ask me like, well, when are you going to get cleared? Can you go back to lifting? I mean, I had an injury doing American Ninja Warrior obstacle training, and it was like 3 to 6 months, but like, I don't really know.
Yeah.
I mean, and so my timeline has been, well, I went back 10 days after the surgery, and then I went back another 3.5 weeks after, and then I have another appointment 6 weeks from then. And so it's kind of these incremental phases that aren't really outlined for a patient. And maybe I just didn't know the questions to ask.
Yeah. I mean, I think it's tough. I think you don't know the questions to ask if you're not familiar with the surgery or someone who's had the surgery before or what it may be. And really, I mean, people performing the surgery, they want to get you better. Like they know they need to fix these things in order for you to get better. So that's kind of like, everybody has a different focus, I mean, it's tough to put a timeline on everyone too, because you don't know how they're going to respond to the surgery. How's their body going to respond? Is their tissue just going to, just tighten up? Or are they really tense? Or are they really, there's so many different variables that we don't think about when you're talking about healing properties and the recovery process. I mean, there's just so much that goes into it. So, it's tough. Usually I've always told people, like, look, it could be up to a year before it feels totally normal.
Mm-hmm.
Now, does that mean you can do those things prior to that? Absolutely. But it might not be the way it felt prior to surgery until that point. And it may be even further along than that. So, you don't want to give people false hope, I think is kind of the key. So it's really hard to nail down dates,
It is. Yeah. It is. Absolutely. I feel that firsthand. I mean, just initially they told me I'd be in my sling 10 days to a month. And I was like, I'm in great shape. I'll be out in 10 days, like maybe 9. No, that was not the case.
Yeah. Right. 5 weeks.
Yeah. Granted, I was kind of only in it upstairs while training, but and then it really did. It felt so much better to be out of it and getting some movement in there. Yeah. But it's been an experience. I feel like I can relate to our clients a lot better in many ways now. Knowing how tight you can get from sitting still and not moving muscles, like mind boggling.
To move, you gotta move.
People, we gotta get up and move. Holy cow. Yeah. So, okay. So talking about, I think it's kind of fun now. We've really, one reason why we all wanted to bring you in and have you as a part of this business is because we felt like there was a disconnect between people leaving physical therapy and trying to go return to sport without having that in between of like, hey, yes, you've been cleared from physical therapy, but you're not quite ready to take on the field. Or maybe the coach has no idea, like, what can they do and how do you get them back from, they've been cleared from physical therapy. How do we get back to playing in the game? So I guess my question for you is, where is the line? I guess there's a few questions. Where's the line between physical therapy and personal training? Like, at what point can they cross over, and when do you move from one to the other? And I guess there's 3. There's physical therapy, there's personal training, or kind of this return to sport area, and then there's the sport. And there's overlap with all of them.
Right. I mean, it's always tough because there's so many checks and balances, right? I mean, you have insurance that can be a limiting.
I don't want to talk about insurance.
Can be a limiting factor, right? So, I mean, say you have a rotator cuff patient that could take 3 to 6 months for you to rehab, but they only get 25 visits a year, and that's like a hard cap by their insurance, right?
What do you do?
I mean, you try to appeal that and get more, but that's not always going to happen. So,
and if they're not willing to pay out of pocket, then
then you just have to give them a progression of home exercises that they can do.
This is all I can do.
This is all we can do. I've had to do that before.
That's awful.
So you have that as a limiting factor. You have, some of these kids that we were seeing were from an hour away or something like that, and
Golly.
not continuing to take away from their schooling and stuff like that to get them in. So then you have to give them more to do, hopefully they have an athletic trainer at their school, which is not always the case either, that
Yeah.
can keep an eye on them.
Which has also been an interesting dynamic in the last couple of years, like trying to figure out, do I as a personal trainer, do we communicate with the physical therapist or the athletic trainer?
Right.
Like who am I supposed to like go
Yeah.
through, and how do I operate upstairs based on like who's in charge?
Right. Yeah.
Who's
And
running
then,
this train?
yeah. And then at, different doctors have different feelings towards that too. Like they want to be the ones to clear them and return them to sport, or they want to check with the PT or the athletic trainer and say, hey, how much are they able to do so we can clear them? So there's so many, you have to know who you're dealing with and what's going on. But there's definitely a disconnect between, there's only so much that I could do inside of my clinic. We didn't have we didn't have turf. We couldn't move around on turf. We had concrete that we had to run on, which isn't the best thing to run on anyway.
No.
Then you have multiple patients that are there also when you're trying to, really get in some skill work with somebody. So there's so many barriers that you encounter, and it's terrible. But it feels like you're not doing everything you can for that specific patient, and that's where it's like, whoa, like,
Yeah.
what else can I do?
Which makes me a little excited about you being here. Not a little, I mean a lot, but like,
Yeah.
because we can do more of that.
Right.
Even though we don't have maybe all the equipment that you would have at a normal PT clinic, like there's more room for progression here.
Correct. And I
Not
think
that insurance will pay for it, but
I think communication is the most important thing. Like, hey, what are you doing with your athletic trainer? What are you doing on your own exercise wise? What are you doing with your physical therapist? So there's so many, you have to have open communication. And I think that's the defining line. I don't think there is a definite,
Yeah. There's a lot of shades of gray.
There's so much gray, so much gray. So, and then really, I think that this return to sport type of deal, you can get them moving more and you can see them in like closer to game like action or practice like action, versus a smaller clinic where you can't do a whole lot of moving. So that's the exciting thing that I'm excited for. So
good.
Yeah.
Tell me, or tell our audience, what can you do that I can't? Because there's a lot that you can do that a personal trainer can't. So what are the things that a physical therapist can bring to the table that we've been limited on?
Right. So as far as physical therapy goes, I can do a physical therapist evaluation on you, give you like a diagnosis, a therapy diagnosis, so to speak, saying, you have decreased range of motion, decreased strength, whatever it may be, from a more medical standpoint on that. And then I can develop a plan of care to follow, which is basically just a plan, right, of how we're going to treat this, how we're going to make it better. So that's one thing that I can do.
Awesome.
As a personal trainer, you can do,
I would say like we have something similar,
a movement
but
screen, stuff like that. Yeah, but it's not necessarily like, because I have those letters behind my name, now it's a medical type of deal,
so we could still take some measurements and say, hey, based
sure.
on our training and education, like a normal range of motion looks like this, and this is where we've measured you. So we can kind of state the facts.
Yeah. So we can do that. As far as different manual therapy techniques, dry needling I can do.
That's been really successful.
That's been
here.
Really good. Just did some dry needling this morning, so that was fun. Some other manual techniques, cupping, instrument assisted soft tissue mobilization or scraping, things like that. Cervical traction, just different techniques that you may not be comfortable doing as a trainer, that I've been taught to do. So, and then there's always just the continuing ed part of it too, just trying to stay up to date with what the newest, ideas are as far as return to sport and rehab and things like that. I have to stay on top of those things in order to.
What are the newest ideas on return to sport?
There's so many. I mean, there's just so many. There's so much stuff going on. So many different thought processes, and it's interesting, so.
Yeah, I feel like anytime you have spare time, you're looking at some sort of digital course and continued ed.
So which is lovely. It's great.
It is lovely. Yeah.
It's been really fun.
Awesome. Well, I feel like this is a good point to wrap up for today. if you guys have any questions that are physical therapy related, I want you to send them to us. So you can go to Instagram at TTG Sports Performance and send us a direct message. I will put that link in the show notes below for our Instagram handle. You can email us info at ttgnwla.com. I feel like Instagram will probably be the best spot to go.
Yeah.
What's your Instagram?
At Scotty with a IE _ LeBlanc. Yeah.
Awesome. Awesome.
You can add that one in there too.
I will.
I don't know if anybody knows how to spell LeBlanc around here. So.
There's a capital B in there.
There is. There is.
And mine is at Danny Phillips if you want to DM me there. And then if you guys love this, if you want to know when new podcast episodes are published, I want you to text the word podcast to this number, 833-432-2161. Well, I got it right.
It's right there.
It's right
cheat
there.
sheet.
I need a cheat sheet. Awesome. Thank you guys so much for listening today. We will be back next week with another episode. Talk to you then.
All right. Bye.